Hello students, I hope you all are seated. So good evening everyone. Friends, so already discussed half of the questions yesterday night. So rest remaining questions of INI-CET Pharmacology Part 2 will be discussed now. So let's start with question number 23. I think this question we have already discussed. So can you tell me two immune checkpoint inhibitors I have already told you yesterday, which are approved for? Good afternoon, Diksha. Two immune checkpoint inhibitors which have been approved for endometrial cancer. Which two immune checkpoint inhibitor I told you yesterday? They were approved for endometrial cancer. The first was durvalumab and the second was pembrolizumab. So these two immune checkpoint inhibitors have been approved for endometrial cancer, which we discussed yesterday also. Fine. So now let's jump to the next question. Now the question number 24 is asking you correct match regarding the side effects of antihypertensive. Anyone who can answer it? Pujari ji, you are absolutely right. Now tell me the answer of this question. This question was asked last year in INI-CET exam. So the answer for this question is calcium channel blocker, verapamil, which produce constipation. Okay, so let's discuss all antihypertensive right now here only and their side effects. So first of all is hydralazine. Sir, what is hydralazine? It is a potassium channel opener, and because of this reason it is a vasodilator. Which vessel it dilates? It dilates artery. And among three potassium channel opener, we have three drugs. Remember MDH. You know MDH, masale? One is minoxidil, diazoxide, and hydralazine. So these are the three potassium channel opener which are artery dilator. Minoxidil, remember, it is also given for the treatment of alopecia. It's a vasodilator used in hypertension as well as alopecia. Diazoxide, it is also given in the treatment of insulinoma because it inhibits insulin secretion. And hydralazine is rather given in the treatment of heart failure. Remember, heart failure is not the side effect of hydralazine, it is rather the indication of using hydralazine. Okay, yes, another drug, student has already answered, nicorandil. Nicorandil is given for the treatment of angina as a potassium channel opener. Now, the main side effect of hydralazine, which you must remember, hydralazine is a part of ship drugs. I hope you remember ship drug. Sulfonamide, hydralazine, isoniazid and procainamide. And all ship drugs, they are metabolized by acetylation. And in slow acetylator, the common side effect of ship drug including hydralazine is drug-induced SLE, that is DLE. So the main side effect of hydralazine is daily. Understood? Next is verapamil. Verapamil is a calcium channel blocker. Now, what is the common side effect of calcium channel blocker? Remember, okay, remember, forget, HUC. Now, calcium channel blocker, they relax muscles. They are also arterial dilator. Now, if you dilate artery on face, it will lead to flushing, edema. They produce ankle edema. They reduce BP or hypotension. They relax GIT muscles, which can lead to GERD. They relax uterine muscle, which will lead to tocolytic action. Uterus will relax. Headache is their most common side effect. Now they relax detrusor muscle, hence they produce urinary retention. They relax intestinal muscles, hence they produce constipation. So the answer of our question is constipation. Side effect of calcium channel blocker is a very commonly asked question. Now just remember, verapamil and diltiazem are two calcium channel blocker which are never combined with beta blocker. Verapamil and diltiazem, these two calcium channel blockers, they are never combined with beta blocker. Very commonly asked question. Never combined with beta blockers. Because these two drugs, they act on heart and there will be marked cardiosuppression. The patient will go into bradycardia and patient may die also. Fine. Next is L-chirin. Any drug that ends with the word iron is an direct. Renin. Ren means renin. I means inhibitor. And remember, any drug which inhibit RAS pathway, renin, angiotensin, aldosterone system, there are two more drugs which act on RAS system. One is ACE inhibitor and second is AT1 receptor blocker. ACE inhibitor, they will end with the word pril. AT1 receptor blocker, they will end with the word sartan. All RAS inhibitor drugs, remember, they produce a side effect of hyperkalemia. The reason is these drugs, they reduce aldosterone production. Now the normal work of aldosterone is to produce hypokalemia. If you reduce aldosterone level, it will produce opposite effect, that is hyperkalemia. Atenolol is a beta blocker. It produces hemolytic anemia. The answer is no. Which antihypertensive drug produce hemolytic anemia? Anyone who can answer? That antihypertensive drug is given in pregnancy also. Hemolytic anemia is produced by alpha methyl dopa. Which antihypertensive drug produce hemolytic anemia? Alpha methyl dopa. Okay, atenolol is a beta blocker. It will produce bradycardia. I hope you have understood. Good. Now, which anti-diabetes drug causes fracture? Now, this is a very commonly asked question. Anyone who can tell me the answer of this question? The answer for this question is canagliflozin. Any other drug which can also produce fracture? Yes, fractures is also produced by pioglitazone. Now, what is this canagliflozin? Any drug that ends with the word flozin, like canagliflozin, dapagliflozin, empagliflozin, they are SGLT2 inhibitors. Now, SGLT stands for sodium glucose transporter. So sodium glucose transporter, this transporter is present in PCT of nephron or PCT of kidney, proximal convoluted tubule, and they produce sodium and glucose excretion. Now the point is, when sodium is excreted out in urine, in the terminal part of nephron, sodium gets exchanged with calcium also. Because of this reason, it will indirectly also produce calcium loss, calcium and phosphate loss. Because of this calcium and phosphate loss, they will produce fractures, or you can write osteoporosis. Okay, first there will be osteoporosis, which will later on lead to fragile fractures. Pioglitazone also produce fractures. Pioglitazone is PPAR gamma agonist. Now let's discuss all the drugs in diabetes at one place and their important MCQ which comes in diabetes. Important MCQs which comes in diabetes. Now, which anti-diabetic drug produce hypoglycemia as a side effect? I will give you a trick. First drug we all know is insulin produce hypoglycemia. Second point, any drug that ends with the word amide or any drug that starts with the word glee and any drugs that ends with the word glenide will produce hypoglycemia. So can we remember these three words? Amide, glee, glenide. I'll give you an example. Chlorpropamide, glipizide, gliclazide. Remember these two classes of drugs, they are known as sulfonylurea. Sulfonylurea, they either end with the word amide or they start with the word glee and they promote insulin secretion from beta cell of pancreas. Insulin will cause hypoglycemia. And any drug that ends with the word glenide like repaglenide, natiglenide, these drugs are younger brother of sulfonylurea. These drugs are known as meglitinide. They also produce insulin secretion from beta cell of pancreas. Remember these three tricks how to remember which drug will produce hypoglycemia. Now, which anti-diabetic drug produces weight loss? The first class of drug that will produce weight loss is GLP-1 analog. That is glucagon-like peptide 1 analog. These drugs, they will end with the word nartide or they will end with the word glutide. Fine. So can you tell me certain drugs that end with the word nartide like exenatide? And two drugs we discussed yesterday were liraglutide, semaglutide. Liraglutide, semaglutide. We discussed yesterday. Any other drug which causes weight loss? You'll write metformin. Metformin produce weight loss. And the third drug you should remember is SGLT2 inhibitors. And we know SGLT2 inhibitor, they end with the word flozin. They end with the word flozin like canagliflozin, dapagliflozin. So these drugs will produce weight loss. Weight gain. We know that insulin is an anabolic hormone. Insulin, sulfonylurea, glenide. These drugs, they were producing hypoglycemia, but these drugs, they also promote weight gain. And the last drug you must remember which promote weight gain is pioglitazone. Last drug that will promote weight gain is pioglitazone. Fine. Now, which drugs are given for the treatment of diabetic retinopathy? Remember, these drugs are anti-VEGF drug, vascular endothelial growth factor, because these drugs, they inhibit formation of new blood vessels on retina, which you call it as neovascularization. So VEGF stands for vascular endothelial growth factor. The function of this growth factor is to promote formation of new blood vessels. This factor increase in diabetes because of ischemia in retinal blood vessel, they release this factor. So what are the drugs? You have to remember a very, very important drug, bevacizumab. The drug name is bevakizumab. How we can remember bevakizumab? V for it inhibit VEGF, and hence it inhibit angiogenesis. Angiogenesis means formation of new blood vessels. Now remember, there are three more drugs which are given in diabetic retinopathy, but if you remember bevakizumab, it will be more than enough for you. Now, which drug does not require any modification in dose modification in renal failure? The question you have to remember is linagliptin. Linagliptin renal failure में लेना है. It is the safest anti-diabetic drug in renal failure. There is one more drug, tedigliptin. It is available in India and we are prescribing this drug. So two gliptins which are safe in renal failure is linagliptin and tedigliptin. Don't forget the name linagliptin. Any drug that ends with the word gliptin is DPP4 inhibitor. Dipeptidyl peptidase inhibitor gliptin, they end with the word. Okay, they are safe. Any other drug? Yes. GLP-1 analog. And the name of the drug is dulaglutide. And the last drug is pioglitazone. So three drugs you have to remember which are safe in renal failure. You don't have to reduce the dose in renal failure. Now the follow-up question is, remember very important question, metformin is contraindicated in renal failure. So if the GFR is less than 30 ml per minute, we never give metformin to our patient. So which drug should be avoided in renal failure? Metformin. Fine. Risk of fractures. Risk of fractures, beta, we already discussed two drugs, SGLT2 inhibitor and pioglitazone. Now a question is, which drug has risk of causing diabetic ketoacidosis? DKA stands for diabetic ketoacidosis, SGLT2 inhibitors. So you will get a new answer of canagliflozin or dapagliflozin. Okay. They increase the risk of diabetic ketoacidosis. Urinary bladder cancer as a side effect, pioglitazone. From urinary bladder, we all pee. P means peeing, risk of peeing, urinary bladder cancer, P for pioglitazone. Fine. Which drug should be avoided in heart failure? Pioglitazone. Why pioglitazone should be avoided in heart failure? Because it has anti-diuretic effect. It increases plasma volume, which will put more pressure on heart. Now, which drug is given for the treatment of heart failure? That is SGLT2 inhibitors. SGLT2 inhibitors, they have diuretic action. Hence, they will reduce preload or plasma volume. Okay. Now, which anti-obesity drug has been approved? I think we already have discussed. Liraglutide by injection, semaglutide orally. These drugs are GLP-1 analog, glucagon-like peptide 1 analog. A follow-up question. A new drug recently got approved in diabetes. Which drug have recently got approved in diabetes? You will write, it's a potential question. Dual GLP-1 plus GIP analog. GLP-1 stands for glucagon-like peptide. GIP stands for glucose-dependent insulotrophic hormone. The drug name is tirzepatide. This drug got approved 6 months back for the treatment of type 2 diabetes. Now, which drug is GLP-2 analog? GLP-2 analog is teduglutide. Now, it has been approved for the treatment of tirzepatide for type 2 diabetes mellitus. Teduglutide is not given in diabetes mellitus. Teduglutide is given for the treatment of short bowel syndrome. It is given for the treatment of short bowel syndrome. I hope you have understood. So these questions are expected question from diabetes mellitus. Fine. Now let's talk about the next question. A lady with hypomania. She wants to conceive. She wants to become pregnant. The most teratogenic drug that must be avoided in this female should be anyone. What is the answer? What is the answer? Which drug should you should not give in mania? You know, mania is a part of bipolar disorder, and drugs which are given in bipolar disorders, they are known as mood stabilizers because they will prevent mania and depression. Mania and depression are mood disorders. So what is the answer of this question? So students have confusion between lithium and valproate. Remember, lithium is teratogenic. Valproate is also teratogenic. But which drug is most teratogenic? The answer for this question is valproate. Now I will tell you the reason for this question. Why this question was asked, I will tell you. But remember, the drug of choice for BPD in pregnancy is antipsychotic drugs. Any drug which is an antipsychotic here? Olanzapine. Olanzapine is an antipsychotic drug. Now the point is, let's understand this controversy easily. Remember, the most teratogenic drug is valproate. I'll tell you, valproate produce neural tube defects. You can see this neural tube defect like spina bifida. Now the point is, the incidence of neural tube defects is 1:50 pregnancy, that is 2%, and it cannot be corrected after birth. You cannot correct this neural tube defect after the birth. Very simple. Now lithium is also teratogenic. Remember, lithium affect heart, development of heart, which you call it as Epstein anomaly. So lithium causes Epstein anomaly. Epstein anomaly is a type of cardiac malformation. So there is defect in tricuspid valve. So tricuspid valve is not produced properly. Right atria and right ventricle will become a single chamber. On X-ray, you will find a box-shaped heart, which you will learn in radiology. Now the point is, this Epstein anomaly, it is seen in 1:2 lakh people. So don't you think the incidence of Epstein anomaly is very less? Second point, Epstein anomaly can be easily corrected after birth by surgery. By surgery, you can easily correct Epstein anomaly. Now tell me, if you have to avoid one drug among valproate and lithium, which is the most teratogenic and the birth defect cannot be corrected after birth, the answer is valproate. The answer is valproate. Understood the difference? Now tell me a very commonly asked question, very repetitive asked question. A patient of schizophrenia was taking risperidone. You know that risperidone is an antipsychotic drug, and he presented to OPD with upward gaze. This upward gaze you can see, this upward gaze is known as oculo. Eyes are going towards the brain. You know, brain has gyrus, oculogyric crisis. We call it as upward gaze as oculogyric crisis and abnormal body posture. So can you tell me what problem this person is facing? This person is facing antipsychotic drug. They produce extra pyramidal symptoms. Antipsychotic drugs, they block dopamine receptors in brain, which will lead to drug induced Parkinson. And you know what happens in Parkinson disease? There is muscle dystonia. The muscles becomes rigidity, or there is increase in tone of the muscles. So this is what the person is suffering from. Now, for normal Parkinson disease, that is neurodegenerative Parkinson disease, we give levodopa. Agreed? But levodopa is not effective in drug-induced Parkinson disease. For drug-induced Parkinson disease, the treatment of choice is anticholinergic drugs. So here we give anticholinergic drugs for the treatment of drug-induced Parkinsonism. The drug name you have to remember, very commonly asked, is benzhexol. Benzhexol, don't forget it. Other drugs are also there. Benzhexol is also known as trihexyphenidyl. You can see both are having hex word in it. Other drugs are also there, but try to remember benzhexol. Next drug is benztropine. Now, actually, if you go in hospital, you will not find benzhexol very commonly. What we find in hospital is Phenargan syrup. Heard about Phenargan syrup? So that Phenargan syrup is promethazine. Although it is an antihistaminic drug, but it also has anticholinergic action and diphenhydramine. These drugs are most commonly used drug for the treatment of drug-induced Parkinsonism, but remember drug of choice is benzhexol, although it is not easily available in hospital. So question will come on promethazine or diphenhydramine. Now let's talk about the remaining drugs which is written. So the answer of our question comes out to be promethazine, the correct answer. Now what is valbenazine? Valbenazine and tetrabenazine. Any drug which ends with the word benazine is a VMAT inhibitor. You don't have to remember what is VMAT, vesicular monoamine transporter, that you don't have to remember. Just remember these drugs deplete dopamine. They are known as dopamine depleter. And valbenazine and tetrabenazine, they are used in the treatment of Huntington's disease. Huntington's disease is opposite of Parkinson disease, in which there is excess of dopamine level in brain, which leads to abnormal movement known as chorea. It is also given for treatment of one extrapyramidal symptom known as tardive dyskinesia. It is also given for the treatment of tardive dyskinesia, tetrabenazine and valbenazine. Haloperidol, it is an antipsychotic. Its side effect is extrapyramidal symptom. Levodopa, it is given for neurodegenerative Parkinson disease. It is not given for drug-induced Parkinsonism. It is given for neurodegenerative Parkinson disease. Okay, it is given for neurodegenerative Parkinson. I hope you have understood. Let's come to the next question. Active form of cyclophosphamide, although the answer is already written, the answer is 4-hydroxy cyclophosphamide. Now remember, cyclophosphamide is a prodrug. It gets converted into 4-hydroxy cyclophosphamide, and this 4-hydroxy cyclophosphamide gets converted into two other active form. One is some aldophosphamide or phosphoramide mustard. This you don't have to remember. This you don't have to remember. Phosphoramide mustard. No, you don't have to remember. What you have to remember is one form known as acrolein. Now this phosphoramide mustard has anti-cancer effect. So can we say cyclophosphamide is an anti-cancer drug? This acrolein produces the typical side effect of cyclophosphamide. It damages urinary bladder, which you call it as hemorrhagic cystitis. It produces a typical side effect of hemorrhagic cystitis. So the patient will have painful hematuria. So patient will have painful hematuria. Fine. Now let's write all the side effects of anti-cancer drug at one slide, which I have already told you. So let's start with hemorrhagic cystitis, bladder damage. Hemorrhagic cystitis or bladder damage is caused by two drugs because they produce acrolein. The first is cyclophosphamide and the brother of cyclophosphamide, ifosfamide. Now how you treat this hemorrhagic cystitis? The antidote for the treatment is Mesna. Antidote for the treatment is Mesna for the treatment of hemorrhagic cystitis. Now above urinary bladder, you know there is kidney. So a drug which causes kidney damage, nephrotoxicity, is cisplatin. Cisplatin produces kidney damage, cyclophosphamide produces bladder damage, and the antidote for the treatment is amifostine. Okay, amifostine. Now remember, amifostine is a nephroprotector. It protects kidney from cisplatin. Amifostine is also a radioprotector. It protects the normal body cells from radiotherapy. Okay. Now here you have a follow-up question. Amifostine protects the normal body cells from radiotherapy. Do we have a drug which makes the cells sensitive to radiotherapy? Yes, we have a drug which are known as radiosensitizer. Radiosensitizer makes cells sensitive to radiotherapy. You have to remember only three drugs for your exam. The first drug is 5-fluorouracil. Second is cisplatin. Second is cisplatin. And the last drug you have to remember is gemcitabine, because these three questions have been asked in radiosensitizer. Remember, these two drugs are given in combination. And in which cancer they are used as a radiosensitizer? First is head and neck cancer. And the second cancer you have to remember is GIT cancer. So they are used as a radiosensitizer in combination we give. Gemcitabine is given as a radiosensitizer in which cancer? Pancreatic cancer. It is given as a radiosensitizer in pancreatic cancer. I hope you can remember this part. Easy. They have been asked. Now, other common side effect. Now, which drug, let's move above kidney. Which drug produce heart damage? Heart, cardiotoxicity. Remember these drugs, they will end with the word rubicin. Remember, any drug that ends with the word rubicin will produce cardiac damage like dilated cardiomyopathy, myocarditis. We don't have to remember that. Now, doxorubicin, donorubicin, epirubicin, any drug ending with the word rubicin will produce cardiac damage. Another name of doxorubicin is adriamycin. Adriamycin is another name of doxorubicin, and their group is known as anthracycline. In anthracycline, remember any drug, it will end with the word rubicin. Rubicin word will come. Now, do we have any antidote? Yes, we have an antidote. The antidote for cardiotoxicity is dexrazoxane. The antidote is dexrazoxane. Now, other drugs you can simply mug up. Pulmonary fibrosis. Just remember the name bleomycin. I will come back to bleomycin. Which drug is most emetogenic anti-cancer drug? Most emetogenic anti-cancer drug is cisplatin. Now remember, any drug, any anti-cancer drug which produce vomiting, We call this disease as CINV. Can you tell me what is CINV? CINV stands for chemotherapy induced nausea and vomiting. For chemotherapy induced nausea and vomiting, we give treatment with anti-emetic drugs. We give treatment with anti-emetic drug, and most emetogenic is cisplatin. Now, which anti-emetic drug will give? You will write for early phase. For early phase of chemotherapy induced nausea and vomiting, we give cetron. Cetrons are 5-HT3 antagonist. Can you tell me certain name of cetron? Ondansetron, granisetron, tropisetron, cetron. But for delayed phase or late phase means it occurs after 24 hours. For delayed phase, we give pitant. Pitants are NK1 neurokinin 1 antagonist. So can you tell me certain name of pitant? Aprepitant, netipitant, okay. Now if pitant are not working, the second drug we can give is CB1 agonist. CB1 is cannabinoid 1 receptor agonist. The drug is dronabinol and nabilone. Now remember, there are other antiemetic drugs also, but question will come on early phase, cetron 5-HT3 antagonist. Late phase, it will come out to be pitants like aprepitant, netipitant, rolapitant, etc. Cannabinoid 1 agonist, CB1 is cannabinoid, NABI word will come, NABI word will come, dronabinol, nabilone. Understood this point? Yes. Fine. Now other side effect, which drug produce cerebellar toxicity? Cytarabine. Okay, only 1 point. Which drug produce syndrome of inappropriate ADH secretion? SIADH, Vincristine. Which drug will produce ototoxicity? Ototoxicity means 2 years. Cyclophosphamide, cisplatin. Which drug will produce hepatic vein fibrosis, liver vein fibrosis? Busulfan. And the antidote for treatment to prevent fibrosis is defibrotide. D means not happening, fibrosis, fibro word is coming. And the last two side effect is Lovestock neuropathy, side effect of paclitaxel, foot drop neuropathy, side effect of Vincristine. So this is a chemo man, you must remember always, and some additional point with chemotherapy. Now certain other points, because in INI-CET, anti-cancer drug is a very famous topic. You have to learn anti-cancer drug for specifically for INI-CET. So which anti-cancer drug is contraindicated in Crigler-Najjar syndrome? Recent question. The drug is irinotecan is not given in Crigler-Najjar syndrome. Which drug produce hand-foot syndrome, damage of palms and soles? Hand-foot syndrome is produced by, remember, two drug, 5-fluorouracil and its pro-drug capecitabine. Now can you tell me which type of pigmentation you can see here? Just like feathers. This is known as flagellate pigmentation. Flagellate pigmentation is a side effect of bleomycin. Flagellate pigmentation, bleomycin. Second, you can see the skin has become hyperkeratotic. The keratin deposition has skin increase. So it is looking like fish-like skin. Fish-like skin is known as ichthyosis. Again, the side effect of bleomycin. And the third side effect of bleomycin you must remember is pulmonary fibrosis. Pulmonary fibrosis is a side effect of bleomycin because bleomycin damages type 1 alveolar cell. Type 1 alveolar cell is damaged by bleomycin. So can we remember three side effects of bleomycin? Flagellate pigmentation, pulmonary fibrosis and ichthyosis. Fine. There is one antiarrhythmic drug which will also produce pulmonary fibrosis, but rather damaging type 2 cell. Okay. Okay. Type 1 cells are known involved in gas exchange. Type 2 cells are responsible for surfactant secretion. The answer is amiodarone. Amiodarone rather damages type 2 cell, and it also produces pulmonary fibrosis. Amiodarone is an antiarrhythmic drug. I hope you have understood this. So this slide is important for you. Let's come to the next question. I promised you yesterday I will specifically discuss paracetamol in great detail. So let's talk about a patient who has pre-existing liver disorder, developed progressive liver dysfunction after consumption of a drug, and the metabolite of this drug is NAPQI. The metabolite of this drug is NAPQI. So, what is the answer? The answer of our question is paracetamol. The answer for our question is paracetamol. So, remember few points about paracetamol. Remember, paracetamol, when goes to the liver with the help of CYP2E1, cytochrome P2E1, it gets converted into NAPQI. You don't have to remember the full form of NAPQI. And this NAPQI is highly hepatotoxic. It is highly hepatotoxic. Now the point is, it causes centrilobular necrosis with periportal sparing. Now what does it mean? The cells around central vein will become damaged, and the cells around portal triad will be spared. This is known as centrilobular necrosis with periportal sparing. So how to protect? The antidote for protection from hepatotoxicity is N-acetylcysteine. So if you want to protect liver, you give N-acetylcysteine. Okay. But if you want to excrete paracetamol in urine, we give sodium bicarbonate. Now the point is, N-acetylcysteine is the specific antidote of paracetamol poisoning. Sodium bicarbonate is a non-specific drug. It can be given for any acidic drug poisoning. Okay. Now just remember two additional point, that alcohol and smoking, it increase the activity of CYP2E1. That is why paracetamol hepatotoxicity risk is more in cases of alcoholics and smoker. Two additional points with paracetamol. Paracetamol is the safest NSAID, non-steroidal anti-inflammatory drug in renal failure. Follow-up question. Rest all other NSAIDs are nephrotoxic. Paracetamol is the safest NSAID in children because other NSAIDs like aspirin, if you will give in children, it will cause a dangerous side effect known as race syndrome. That is why we don't give aspirin in children unless and until the disease is very severe. Like Kawasaki disease we give, otherwise we don't give aspirin in children. I hope you have understood this concept. So in children, in renal failure or any other condition, the safest NSAID is paracetamol. Next question. A pregnant lady with type 2 lepra reaction. How to treat it? My first question is, for type 2 lepra reaction, will you give thalidomide to that lady? Will you give thalidomide? No. You know thalidomide? Thalidomide is given in type 2 lepra reaction, but we never give because it is highly teratogenic. It causes pocomelia. Pocomelia means short limbs. So the answer of our question is continue MDT. MDT is multi-drug therapy. So drugs for leprosy are known as MDT, multi-drug therapy, and add corticosteroids. So let me tell you a little few points about leprosy. In leprosy, we give the drugs MDT, multi-drug therapy, and we give three drug RDC, that is rifampicin, which is given once a month, supervised, or you will write under supervision in front of a doctor. The person will eat Dapsone, which is an anti-folate drug. It is given daily, and the patient will eat at home, not under supervision. And clofazimine, it is given both once a month and daily. Now MDT is given for 6 months in cases of possibacillary leprosy, and it is given for 12 months in multibacillary leprosy. Fine. Now the problem with MDT is hypersensitivity or allergic reaction. Hypersensitivity, it is of two types. You'll write type 1 lepra reaction. Second is type 2 lepra reaction. In type 1 lepra reaction, also known as reversal reaction. Type 2 lepra reaction is ENL, that is erythema nodosum leprosum. Now, what is the treatment? Remember, treatment is continue MDT. Leprosy drugs should not be stopped, and add corticosteroid prednisolone. Prednisolone. Now the point is, in this prednisolone you will write, if this case is main problem occurs in type 2 lepra reaction, ENL. ENL is more dangerous form. Now if there is steroid dependent, if the person is not able to stop steroid, you continue clofazimine for extra months. Normally we give MDT for 12 months, but here we will give clofazimine for another 6 months generally we give. But if the patient is having steroid resistant ENL, then we give thalidomide. I hope you have understood this concept. I hope you have understood this basic concept. Steroid dependent, continue clofazimine because clofazimine has immunosuppressive action. Steroid resistant, thalidomide. Thalidomide is only given in type 2 LR, but remember thalidomide is contraindicated in pregnancy. It is category X drug. Okay. I hope you have understood leprosy. Next question. Which drug is not used in sickle cell anemia? Anyone? Which drug is not used in sickle cell anemia? The answer of this question is Peptilovimab. Peptilovimab is a antibody against COVID-19 spike protein. Spike protein of COVID-19. Rest all other drugs are given for Rest all other drugs are given for sickle cell anemia. Now remember, these are the drugs we have for sickle cell disease. Now the drug of choice for sickle cell disease is hydroxyurea. Okay, drug of choice for sickle cell disease is hydroxyurea. Because hydroxyurea increase fetal hemoglobin synthesis, hence they will have alpha and gamma chains. Alpha and gamma chains. In sickle cell disease, there is defect in beta chain of hemoglobin. So, fetal hemoglobin does not contain beta chain. Glutamic acid. Now, these two new drugs you have to remember. Voxelotor. Voxelotor inhibits sickling or attachment of WBC to RBC together. And which monoclonal antibody has been approved for sickle cell disease? Crizanlizumab. Crizanlizumab has been approved for sickle cell disease. It also inhibits attachment of RBC together. The last two drugs, remember, they inhibit sickling. Sickling means attachment of RBCs together because it will lead to occlusion of blood vessel. Fine. Next question. Best measure of extent of absorption. Anyone? Now remember, if you take a drug orally, let's say you have taken a drug orally, can we say this drug will comes into your plasma slowly and slowly with time? So this drug is coming into plasma with time. So I have made a graph, concentration time graph. Which graph? Concentration time graph. Agreed? Agreed? Now, can we say this is Cmax? Cmax tells you about maximum concentration in plasma. Then we have Tmax. Tmax tells you about rate of absorption, that by what speed the drug will come out into the plasma. Speed, rate of absorption, Tmax. And this whole area under curve, this whole area under curve, it will tell you about the total extent of absorption, that how much amount of drug is coming into the blood with time. So can you tell me what is the answer of our question? Can you tell me the answer of our question? The answer of our question is AUC. Okay. Cmax, maximum concentration. Tmax, it tells you about rate of absorption. And AUC tells you about the total extent of absorption. This question came 6 months back in INI-CET exam. Tmax is a very commonly asked question. Rate of absorption, Tmax. Don't forget it. Next question. Paracetamol 500 milligram when tested actually contained 200 milligram. Which is this type of counterfeit drug? Anyone? Now first let's understand what do you mean by counterfeit drug. Counterfeit drugs are illegal drugs and they are made with an intention to cheat, or you can write intention to harm, any one of the following. And if any person is making this counterfeit drug, that person is jailed and fined. Now there are three types of counterfeit drugs. We will see what is the correct answer. First let's understand. First is spurious. First type of counterfeit is spurious. Second is known as misbranded. And third is known as adulterated. Now, recently the name have been changed. Spurious is also known as falsified. Spurious drugs are also known as falsified drug. Falsified drug means you went to the chemist and asked for 500 milligram of paracetamol. When you tested, there is no paracetamol in it. When you tested this drug, there is no paracetamol in it. So this is known as spurious or falsified drug. I hope you have understood. Misbranded. Misbranded are also known as substandard drug. This is a big problem in India. Misbranded. You went to the chemist, you asked for 500 milligram of paracetamol, and when you tested this drug, it contained 200 milligram of paracetamol. So why a person is making such kind of a paracetamol? These are low quality drug. To increase the profit margin, people they make less quality of drug. Adulterated means you are adding some addition of some harmful excipient. Excipient means apart from active drug, you have added some harmful substance. You heard about a recent tragedy of cough syrups. You heard about a recent tragedy of cough syrup and consumption of this cough syrup. Children in Africa they died because this cough syrup was containing a harmful chemical known as ethylene glycol. Remember? I hope you had heard this news. So can you tell me which category of this drug will classify? Spurious, misbranded or adulterated? A recent tragedy, a pharmaceutical company in India was making a cough syrup and it was exporting to Africa and children died because it was having a harmful chemical ethylene glycol. So these type of drugs are known as adulterated. The answer for our question is misbranded. The answer for our question is misbranded. These are substandard drug, which is a big problem in India. The quality of drugs is very substandard. So answer for our question is misbranded. Next question. 5-alpha reductase inhibitor in BPH. You all know what is BPH. BPH stands for benign prostate hypertrophy. Okay. Yes, you all are right. So have clear concept. If your concepts are good, nobody can stop. Now, what is 5-alpha reductase? The answer for this question is C. They reduce serum dihydrotestosterone. So I will tell you this point. So what happens in benign prostatic hypertrophy? The prostate size increases and the bladder outlet obstruction. There is bladder outlet obstruction. So in the treatment of BPH, you give two types of drug. Open bladder outlet. Second is reduce prostate size. Reduce prostate size. Two types of drug. Now to open bladder outlet, we give alpha 1A blocker because they will open sphincter. The drug is tamsulosin and silodosin. Now the problem is with these drugs is if you open the bladder outlet, don't you think the secretions will go back into the bladder? So they can lead to retrograde ejaculation. Fine, retrograde ejaculation. Now to reduce prostate size, you give 5-alpha reductase inhibitor. These drugs they inhibit the conversion of testosterone into its active form. Reductase means addition of hydrogen. So testosterone gets converted into dihydrotestosterone. So the drugs are finasteride and dutasteride. Don't forget the name, very commonly asked question. Finasteride and dutasteride. Now these drugs apart from use in BPH, these drugs are also given in the treatment of alopecia with minoxidil. I told you minoxidil shortly. So these drugs are also given in treatment of alopecia with minoxidil. As a topical cream, they are available. Fine. Now a follow-up question. Now there is another drug known as alpha 1 blocker, not alpha 1A, because alpha 1 receptor is of two type, alpha 1A plus alpha 1B. These drugs, they end with the word zocin. Z word will come here, like prazosin, terazosin, doxazocin. Now, how to remember? They are not having any Z word, they will have Z word in it. Now, these drugs are given for BPH because alpha 1A blockage will improve outlet symptom plus hypertension. If the patient is also having hypertension, then we give prazosin. Now, what is the side effect of prazosin? Prazosin leads to postural hypotension. This postural hypotension with prazosin is known as first dose effect. Is known as first dose effect. Last point with prazosin is prazosin, very commonly asked question. Prazosin, it is also given for the treatment of hypertension and pulmonary edema, which is seen in scorpion sting. So, which drug is given for hypertension and pulmonary edema in scorpion sting? Prazosin. Another use of prazosin, BPH with hypertension. Second use of prazosin to control hypertension and pulmonary edema in scorpion sting. Understood this concept? Let's come to the next question. Very commonly asked question. A 42-year-old chronic alcoholic with AST levels and ALT levels are very high. You know, normally AST and ALT, they should be less than 30 and 40, but here it is very high. GGT level is also very high because it's an alcoholic, and this person is showing altered sensorium. Can you tell me what causes altered sensorium in chronic alcoholic? The altered sensorium, one of the reason is delirium tremens. And the drug of choice for the treatment of delirium tremens is IV diazepam. But this is not the correct answer. The problem is diazepam is a benzodiazepine. But this is not the correct answer. No. But diazepam is contraindicated in liver disease. Now tell me the correct answer. But diazepam is contraindicated in liver disease. So which benzodiazepines are safe in liver disease? So remember a mnemonic, total. So we cannot give diazepam. No, we cannot give diazepam. So the answer for our question is not diazepam. The answer of our question is lorazepam out here. The answer for our question is not diazepam. Because you have missed one point. AST and ALT levels are very high. Hence, the patient is having liver disease. So, which benzodiazepines are safe in liver disease? Temazepam, oxazepam. So, I will just maximize this for you. Triazolam, eschazolam, and very important, lorazepam. So, at least try to remember oxazepam and lorazepam. These two drugs you must remember. Full mnemonic I have told you. But remember, although the drug of choice in delirium tremens is diazepam, but you have to check alcohol is the most common cause of liver disease also. Diazepam cannot be given in liver disease. I hope it's clear and we should not do hurry. First read the whole question also. Now, this graph was asked. I will tell you what this graph is. It's easy to understand this graph. From this graph below, what is the type of inhibition exerted by the drug? Okay. Now first see this graph. There are two things written in this graph. One, something is written as Vmax, and here something is written as Km. Okay. Now this graph is known as Line-Weaver-Burke plot. This graph is known as Line-Weaver-Burke plot. Now, just understand this part. In cases of competitive inhibition versus non-competitive inhibition, I will make a dose response curve. The shape of normal dose response curve is dose response. Okay. Now, normally suppose this is an agonist. What happens in cases of competitive antagonist? This is a graph of competitive antagonist. So in competitive antagonist, there is parallel right shift in DRC, because you have to increase the dose of agonist to produce that same level of response. If you want to produce the response, you have to increase the dose of agonist. You have to increase the dose of agonist. Only then agonist will win the competition. Agreed? In cases of non-competitive antagonists, the height will always be less. This is non-competitive antagonist. So in non-competitive antagonist, there is reduction in height in DRC. I hope you have understood. You cannot overcome the effect of non-competitive antagonist even if you increase the dose of agonist. Now remember, this part is known as Vmax. Vmax is response. Response को हम क्या बोलते हैं? Vmax. Response is also known as Vmax. Agreed? And dose is also known as Km. Dose is also known as Km. Remember this part. Can we say that in competitive antagonist, Vmax remains same, but you have to increase Km value. You have to increase the dose to overcome the effect. In cases of competitive antagonist, in cases of non-competitive antagonist, the Vmax will be reduced. Can you see this graph and appreciate? And Km value remains same. Okay. Now, if we can remember this part, Vmax and Km, Vmax remains same, Km has to increase. Now, if we make a reciprocal of this graph, if I make a reciprocal, remember, I'll just tell you one additional point so that you can remember that graph. This graph follows, what is this Vmax and Km? Follow-up question. Vmax and Km, they are known as Michaelis Menten constant. They are known as Michaelis Menten constant. So what is Michaelis Menten equation? Response, which is V, is equal to Vmax into concentration of agonist upon Km plus concentration of agonist. Now, if I reciprocal this, if I reciprocal it, opposite कर देंगे, it is known as Lineweaver-Burke plot. Opposite of Michaelis-Menten is known as Lineweaver-Burke plot. So it will come out to be 1 by V divided by Km upon Vmax. Okay, plus into concentration plus 1 upon Vmax. This is known as Lineweaver-Burke plot. So this equation becomes y is equal to mx plus c. You know what is this equation known as? Y is equal to mx plus c. This is an equation of straight line. Now come back to this graph. This equation of straight line. Can you see this variables I have told you? Can we say that in this graph, Vmax remains same, but Km changes? 1 upon Km changes. So this type of inhibition is known as competitive inhibition. What happens in non-competitive? In non-competitive, the Vmax will change, but Km remains same. So remember these two graph. This is known as Lineweaver-Burke plot. Reciprocal of that. So this is competitive inhibition, competitive antagonist, Vmax will remain same. And here Km will remain same. This is non-competitive inhibition. I hope these two graph you can remember. Okay. Vmax is same. Okay. There is a graph of uncompetitive also, but that is a very complex graph. I don't think anyone will ask you in INI-CET. Okay. It's a very complex graph. So can we say this is a picture for the last moment you can remember? I will teach you in regular classes the graph of uncompetitive antagonist. Okay. If you are very interested, I will teach you. Although it is not given in your books also. Okay. But I will teach you. In higher books it is given, which I have read. I will teach you. So I hope you can remember these two photos in your mind right now. Any point out here? Remember these two photos. Okay. So if they are intersecting competitive, competitors will only intersect each other. So only competitors will intersect each other. So this statement we can remember. Only competitors can intersect each other. Non-competitors, they never intersect each other. So don't you think they are not intersecting? They are starting from origin. Okay. Yes, both reduces, but the graph is something else. I will tell you the graph later on. Now tell me, first see this graph. This is some cell wall. You can see this cell wall word written. This picture came. This is a cell wall. And some mycolic acid word is written. Mycolic acid word is written. Can you tell me which drug acts through CAT G gene and inhibit mycolic acid? The answer of this drug is isoniazid. Now, which drug B, act below mycolic acid and act on arabinogalactan. The drug which inhibit arabinogalactan synthesis is ethambutol. That is ethambutol. Fine. So mycolic acid, CAT-G gene, isoniazid, ethambutol, arabinogalactan. Okay. So I will tell you about this isoniazid. Isoniazid, it enters into TB bacteria and it becomes active with the help of CAT-G gene. CAT-G gene. And by inhibit active form, it inhibits cell wall synthesis, mycolic acid synthesis. Okay. Now, what is the cause of resistance to isoniazid? Resistance to isoniazid is because of mutation in CAT-G gene. Now, what is the function of this CAT-G gene? CAT-G gene produce one enzyme which activates isoniazid. The name of that enzyme is catalase peroxidase. So this enzyme is produced with the help of CAT-G gene, which converts isoniazid into active form. And if there is mutation in CAT-G gene, isoniazid resistance occur. Now, what is the cause of resistance to rifampicin? Remember, rifampicin inhibits RPO-B gene. That means RPO-B gene, it encodes for RNA polymerase enzyme. So rifampicin inhibits RNA polymerase enzyme in TB bacteria, which is encoded by RPOB gene, and resistance to rifampicin is mutation in RPOB gene. Can we remember RPO? RNA polymerase. And this RPOB gene mutation, it can be detected on a test known as CB-NAT test. Heard about CB-NAT? CB-NAT test can tell us about rifampicin resistance mutation in RPOBG. RPOBG. Now, few additional points about TB. TB, many things have been changed. So, what is the answer of this drug? Isoniazid A. Drug A. Okay, drug A. Now, few important one-liners with TB. Now, certain new definition. Now, these definitions we use for TB. One is MDR-TB. You know MDR-TB is multi-drug resistant TB. Then we have pre-XDR-TB. And lastly, we have XDR-TB. XDR stands for extensively drug resistant TB. MDR is multi-drug resistance. Multi-drug resistance is resistance to H plus R. H is isoniazid, R is rifampicin. Very good. Pre-XDR is MDR plus either levofloxacin or moxiflox resistance. Fine. XDR-TB is pre-XDR plus bedaquiline plus linezolid resistance. I hope you can remember this easily now. So these are the new definitions of TB which you must remember. What is MDR, XDR, pre-XDR TB? MDR, XDR TB. Now remember bedaquiline. What is the mechanism of action? Bedaquiline inhibit mycobacterial ATP synthase. Now the next change which occur in TB guideline is that bedaquiline is given in all age groups. Earlier, bedaquiline was only given in people less than 18 years of age. Now bedaquiline is given in all age group. I hope you can remember this point. All age group we give bedaquiline. Two new drugs for TB, that is Dilamanid. Okay, one last point with bedaquiline. Bedaquiline, it is given for 6 months only and it is given with food. Food increases absorption. Now you don't have to remember the dose of bedaquiline because bedaquiline dose, now we have different types of dose. Dilamanid and pretomanid, two new drugs for TB. Okay, these drugs they inhibit mycolic acid synthesis. These drugs they inhibit mycolic acid synthesis. Okay, now the side effect. Side effect of Dilamanid and bedaquiline is same. These drugs they increase QT interval. These drugs they increase QT interval. Pretomanid side effect is peripheral neuropathy. Side effect is peripheral neuropathy. And there is a regimen known as B-PAL regimen. Pretomanid is given in B-PAL regimen. Can you tell me what is B-PAL regimen? Bedaquiline, pretomanid, and linezolid. This regimen is given for the treatment of MDR and XDR TB, all types of TB. This regimen is given for B-PAL regimen. It has been approved in India. This is a recent change you must remember for tuberculosis. These three drugs are important. Okay, fine. So TB question very likely to come. Okay. I think we have already discussed this question. It's a repetition. Redness in eye, photophobia. There is in anterior chamber, there are keratin precipitates. So we can say that the patient is having anterior uveitis. So which anti-glaucoma drug should be avoided in anterior uveitis? We already discussed prostaglandin analogs should be avoided in anterior uveitis. Okay, prostaglandin analog should be avoided in anterior uveitis. Next question. During third trimester of pregnancy, what will be the drug of choice for hyperthyroidism? Now there is a lot of confusion. What is the drug of choice for hyperthyroidism in pregnancy? Now remember hyperthyroidism in pregnancy. Let's clear that confusion because you should be very specific. First trimester, the drug of choice is PTU, propyl thiouracil. Second and third trimester, the drug of choice is either carbimazole, but we very commonly use its active form, methimazole. Now I want to clear one confusion for you people. That propyl thiouracil is contraindicated in second and third trimester. The reason is it is highly hepatotoxic drug. We don't give carbimazole, propyl thiouracil for second and third trimester. We never give. It is only given in first trimester. And second and third trimester, carbimazole and methimazole, they are contraindicated in first trimester. The reason is they are teratogenic. They inhibit the synthesis of skin on fetus. They produce aplasia cutis. They produce aplasia cutis. So remember, there is no single drug of choice for hyperthyroidism in pregnancy. In first trimester, we use different drug. In second and third trimester, we use different drug. You cannot exchange them. Hence, PTU is not the overall drug of choice. Understood this part? Fine. What is the answer of our question? Anyone? What is the answer? The answer of our question is carbimazole. Okay. Just remember radioactive iodine. We use one isotope 131. Iodine 131. It emits beta rays which destroy thyroid gland. So if a patient is not fit for surgery, you can give radioactive iodine. Its half-life is commonly asked. The half-life of radioactive iodine is 8 days. Half-life is 8 days. Lastly, one more question. Which drugs inhibit peripheral T4 to T3 conversion? You know T3 is the active form. Now which enzyme is responsible for taking out of iodine from T4? The name of the enzyme is 5-deiodinase. So 5-deiodinase inhibitor. The name of the drug you must remember PPID. PPID. First is propranolol, propyl thiouracil, iodides like sodium iodide, saturated solution of potassium iodide, and a corticosteroid dexamethasone. There is one antiarrhythmic drug which can also produce this side effect, amiodarone. Why sir amiodarone? Because amiodarone, it contains iodine. IOD word is coming, 37% iodine. Fine. Now these drugs they inhibit this. Now just take this 4 drugs, the first 4 drugs, and in this order they are also the drug of choice for the treatment of thyroid storm. So can you tell me the first drug you will start in thyroid storm? Yes. The first drug you will start in thyroid storm will be propranolol to save the life of a person. In thyroid storm, there is arrhythmias. Patient will die because not because of hyperthyroidism. Patient will die because of symptoms like arrhythmia. Protect heart. Propranolol. First drug. Second drug to be started. PTU. Propyl thiouracil. Still not controlled. We add iodides and corticosteroid like dexamethasone. And these drugs also inhibit peripheral T4 to T3 conversion. Understood? Next. Based upon the details of the graph given below, what is the therapeutic index? Now remember, what is therapeutic index? Therapeutic index, it is also known as safety margin of a drug. And the formula of therapeutic index we all know is TD50 or upon ED50. So therapeutic index, what is the formula? It is TD50 upon ED50. Instead of TD50, we can sometimes write LD50 upon ED50. Now, what is TD? TD stands for toxic dose. So first I will tell you about TD50. Effective dose in 50% of population. TD50 will be or LD50 will be toxic or lethal dose in 50% of population. I hope it's easy to understand now. What is ED50 and TD50? Now can you tell me what is ED50 and TD50 given out here? Can we say ED50 is given as 8, LD50 is given as 128. LD50 is given as 128, ED50 is given as 8. Can you tell me the answer now? You don't have to even calculate, you can simply orally think about in your mind and tell me. Yes, the answer is 16. So if you divide 128 by 8, it will come out to be 16. 16 is the correct answer. So it's a simple question. Don't make this question incorrect. These are the questions which you all should always mark as a correct answer. High yielding question. Okay. Therapeutic index. Okay. So let's come to the last question. A female was on medication for amoebiasis infection. Remember, the drug of choice for amoebiasis is metronidazole. Okay. She had dizziness, nausea, vomiting after alcohol intake. Can you tell me why it is happening? Why it is happening? Why the female is having nausea after alcohol intake? Alcohol will lead to. These symptoms will be produced because of the interaction of which anti-amoebic drug with alcohol? Which anti-amoebic drug interacts with alcohol? Any drug that interacts with alcohol, we call it as disulfiram-like reaction. So we all know the answer, very commonly and simple question, but many times asked is metronidazole. Okay. Now, which drug produced disulfiram-like reaction? Question comes. Okay. So just remember a mnemonic: cyclic GMP. So these drugs should be avoided in alcoholics. The first drug is chlorpropamide. This drug is given in the treatment of diabetes mellitus and cephalosporin. I will come back to cephalosporin shortly. Graciofulvin, it's an antifungal drug. Metronidazole and brother and sisters like tenidazole, ornidazole, secnidazole, agree? And one anti-cancer drug, procarbazine. Procarbazine is an anti-cancer drug. Graciofulvin is an antifungal drug. Okay. Now with cephalosporin, you will write. Remember, you have to remember only one cephalosporin. I am giving you the full list, but remember only one. And the name of the drug is cefoperazone. Don't forget this word, cefoperazone. Okay, cefoperazone. Most important. Other are cefoxitin, cefotetan, cefamendol. But you have to remember only with cefoperazone. Now you will write that these cephalosporins, they have methyl tetraethyl ring. This methyl tetraethyl ring, just remember MTER. Any word we can remember like this. This ring produce disulfiram-like reaction. Now remember, any question will come on cephalosporin. The most likely to be the answer is cefoperazone. I'll tell you the reason for it. Cefoperazone is the most commonly asked cephalosporin. Because cefoperazone, additional point with cefoperazone we will write, it is also the only cephalosporin, one of the cephalosporin which is renal safe. First point, it is safe in renal failure. Also, cefoperazone reduce fibrin level. Because it reduces fibrin level, it can increase the risk of bleeding with warfarin. It can increase the risk of bleeding with warfarin also. Fine. So I hope you cefoperazone most commonly asked cephalosporin. And this completes our discussion for INI-CET exam. And I hope from bottom of my heart, best wishes to everyone. And if you have any doubt, you can ask me on PW MedEd. So there is an Insta page, YouTube page, there is a Telegram. Telegram is the best source where you can ask me question. Okay. There is a Facebook page also where you can ask me the question. Okay. So I will be sharing you in 10-15 minutes. I will be sharing you the PDF of this session on Telegram group. On Telegram group, I will share the PDF. Okay. Revise this session and just see the session of sprint series. If you have time, remember only these two sessions will be enough for your exam. One session is this one, INI-CET for pharmacology, and just see the sprint series of pharmacology. I don't think any question will come out of it. Okay. All the questions will come from this two sessions only. Okay. Only two sessions you have to see. More than enough for your exam. Any exam I am telling you, INI-CET, USMLE, NEET exam. Okay. For FMGE, I have taken a separate session because the questions are not very high level but more conceptual there. Okay. In INI-CET, more of informative sessions, more information you need to remember. So just see these two sessions and your pharma will be finished. Okay. Just these two sessions, nothing else. Okay. So thank you very much. Best wishes for your upcoming exam. I hope you'll have a very good rank. You all get what you deserve. Okay. So let's end this session. Thank you very much.